Canada's community e-talk show with our new series, Youth and Mental Health. Let's do a quick recap of last week's episode, Coping with Stress in a Healthy Way. Dr. Sujoy gave a great insight into what exactly is stress and the signs of someone experiencing extreme stress in their lives. Him and Anu also highlighted what groups of people are the most vulnerable to stress and methods that can help someone to cope with the stress they are facing in their daily lives. If you haven't watched that episode yet, be sure to check it out with a link in our description below. This week for episode 4, Dr. Sujoy and Anu will be diving into a difficult topic, which is dissecting depression. But first, let's go to our news corner with Jathan to learn a bit more about what is occurring within our society.
Hello everyone, this is Jathan and let's dive into the news this week. Bill Guinea is pushing up and powering through a walk across Newfoundland to promote mental health initiatives and awareness in the province. Accompanied by his wife Susan, he is partnering with the Canadian Mental Health Association to raise funds for the cause. Susan Guinea says, "When you have somebody that's coming to grips with what they are experiencing, they don't know how to talk about it and how they are feeling or what they are going through because they're afraid of being looked down upon, which causes depression." The Guineas have been working to promote mental health awareness in this province since 2016 after 2 of their daughters were hospitalized due to anxiety and depression in the year prior. Moving on, a new Canadian study looking at the mental health of mothers before and after the start of pandemic has found that their levels of depression and anxiety almost doubled in 2020, shedding more light on the burden parents are carrying during this crisis. We anticipated seeing increase in depression and anxiety due to parents experiencing various pandemic stresses like income loss and balancing work from home with homeschooling, but a near doubling was surprising, says Sherry Madigan, one of the authors of the study. Another study has found that the majority of Black Canadians suffer from severe depressive symptoms due to racial discrimination. The study conducted by researchers out of University of Ottawa reported that nearly 2/3, 65.87% of Black individuals in Canada suffer from depression, with women being impacted more. Rates of depressive symptoms among Black individuals are nearly 6 times the 12-month prevalence reported for the general population of Canada, Jude Mary Sinnett, an associate professor at the University of Ottawa, said in a press release. If you want to read more about these news articles, head over to our social media feeds and you'll find links to each of them. Now let's head into the unscripted talk segment with Anu and our special guest of the week. Thank you.
Canada has expressed dedication to create a safe space where we can actually discuss important issues regarding mental health and wellness through this e-talk show. Depression is a type of mental illness that negatively affects the way we feel, and in turn, it may even affect the way we actually think and even the way we act. And it might even make us sad and unhappy. So sadness is something that we all experience. It's a normal reaction to a loss or a setback, but it usually passes away. However, depression, as we all know, it's different. Recognizing depression in young people can be a lot more difficult compared to the adults. As young people, they actually experience a lot and their life changes in many different ways. And depression often begins at the age of from your teens to maybe your youth until you're 30 or so. But obviously it can affect everyone. The World Health Organization stated that globally depression is one of the leading causes of illness and disability among adolescents, and with obviously the last worst outcome of suicide being the 4th leading cause of death between the age groups of 15 to 19-year-olds. So it is really vital to treat individuals who have depressive signs as early as possible, especially younger children and teens, so that they can get back to their education and continue blossoming in their lives. Something I wish to emphasize is that depression is not a sign of weakness or a character flaw or anything like that. Most people with depression, all they simply need is some sort of treatment to get better, um, maybe some help from their families, maybe a support with some sort of psychotherapy or medication, or maybe a combination of all those things. Receiving treatment, it really does not make anyone less human, and it does not really mean that you're crazy or something like that. So it just means that, like any other physical illness, you are really taking care of your health and your well-being, and this actually shows your courage and your resilience. So we are going to now head into this segment with Dr. Sujoy. Dr. Sujoy, welcome again to our community e-talk. Thank you so much.
Kinds of negative thoughts, those kind of bad thoughts, and ultimately you have the most serious things, which is suicide, thoughts of suicide or even attempts at suicide. So depression is this. This is what depression is. It encompasses a lot of things, but primarily the most important thing is always persistent sadness, and both a physical tiredness as well as a lack of interest in doing activities which the person liked to do earlier.
No, thank you, Dr. Sujoy. That's put really very, very simply. And the way you've explained, like the three things that really stand out is like sadness and loss of interest and fatigue. Those three things are consistently part of depression. Now, it kind of gives a good understanding of that. Now, I know that depression is really very much prevalent in the youth and the adolescents, which we already have kind of briefly touched upon. But who else is more vulnerable to get or suffer from depression?
So, I mean, depression can actually happen to anybody. It's very difficult to, say that this particular person will have depression, or, this particular person is immune to depression. There really is nothing like that. But if I were to say, then maybe people who are facing persistent stresses in their lives, persistent issues in their life, who have a lot of social or familial problems, whether it is financial problems, marital problems. So some people who have ongoing difficulties are more prone to get depression. Then you have sometimes things runs in families, like many diseases you must have heard, they run in families. Person who suffered from a disease, the next generation is prone to have it, so that can also be there. That is true for all mental illnesses. Apart from that, physical illness is there. So people who have a physical illness may also be prone to have a mental illness. People who already have, whether it's a long-term physical illness like blood pressure, diabetes, or something which happens all of a sudden, whether it's an accident or things like that, or any other, or there is illness in their family. So if they are either they are facing physical illness themselves, or they are witnessing physical illness in their surroundings or other family members and all, so they would be more prone for any sort of mental illness. Then other thing is substance use, addictions, which we say in simple in the language. So alcohol, cigarette, drugs, anything. I mean, almost everything. It can be it can predispose a person to depression, and people who suffer from depression tend to use it as a coping mechanism. So it turns like a vicious cycle. So these are few of the factors, but again, we should be very open and we should accept that anybody can face depression. It's not something to be shameful about, or it's not that something people choose to be, or as you were saying earlier, it is not a weakness.
No, but one thing that you brought out, Dr. Sujoy, which I did not really know myself, was that it can be hereditary. So this depression and mental illness, that it can be hereditary, I was not aware of that, but that's a good point. I mean, obviously there are all the composite points that you have mentioned that really helps everyone understand. So we all can agree that it is essential to have the ability to recognize if someone we know or even ourselves may be experiencing depression. And I mean, that way we can really encourage individuals to seek professional help sooner rather than, when the worst comes out of that. So this really brings me to the question that what are really the warning signs or symptoms of a person who is experiencing depression? I know you briefly touched on the sadness and loss of interest and all those things, but is there anything else that maybe you would like to add which would be more blatant signs and symptoms in a person that would really show that no, definitely this person is going through depression?
Yeah, so I mean, to make it a bit simpler, I mean, there are different people in a person's life who can notice depression. So, like, let's say if there's a particular person, his employer might notice that he is not coming to work, or there is no reason for not coming to work, but is generally the person is delaying coming to work. His performance has dropped in the office or wherever it is that he is working. He does not mingle with his employees. He does not strive hard to look for promotions or things like that. So if that kind of withdrawal is there, which especially in a person who would be a high performing employee, that is something an employer would notice. In the school, a teacher might notice a child who's withdrawn, who does not engage with other children, or excuse me, he does not talk. I mean, performance drops in their studies, or in general, the student appears to be sad or not paying attention. Then family can probably notice it best, because usually family is something with whom people spend the maximum time, so they could probably look out for what I was saying earlier, not having an interest, not sleeping well,
Right.
loss of appetite, not engaging in family functions, not engaging in with people. It could be other way around also. I mean, it's not always sadness. Sometimes there is anger. So, the person may not be appearing sad or crying. Many times people tend to put up a brave front. They may think that they may feel ashamed, feeling guilty, that what are people going to say if I say I am feeling sad. So they may put up a brave front. Then they may get angry if somebody observes something or notices something. So that is unnecessary anger, unnecessary jitteriness is also another sign. And all these things can be noticed by the person themselves within their own body. If I felt that I was getting angry, I'm not enjoying life, I'm sad for no reason, I'm not sleeping well, so I can myself think of go to my physician and think I can
Right.
suspect that I have depression. So there are different people who can look for different signs.
Right. No, definitely. And I think also like the fact that we ourselves are responsible to take care of our mind and body. So, obviously the changes, if we ourselves feel, we can obviously share it with our doctors or take medical help, or even, get the support from our family members or friends or whoever. So this actually brings us to our last question, which is that we have already talked about that, it is best to treat depression as soon as possible, as early as possible, especially for the younger children and adolescents. But my question to you, Dr. Sujoy, is more that how can we treat depression from a medical point of view, like or a psychiatric from a treatment point of view? What types of treatments might be available if somebody has really said no, they have depression and they have sought mental help from doctors? What are the different types of treatments that would be available?
So the treatment depends on the person. It's a very individualized stage of depression a person is in, because there is different stages. Some people tend to come early. Some people unfortunately come when they are very suicidal, or they come with a suicide attempt. So those things, it depends on that. Where the location of the treatment is, a person is highly suicidal, he would usually be admitted in inpatient psychiatry ward, because if you let the person out, unless he has very good family supervision, suicide attempt tends to recur. So of course you have to make sure that their human rights, their autonomy, everything is respected. So they may need to be admitted. So it all depends on what stage they have come. I mean, the intensity of your treatment depends on that. See, one thing is medication. So just like you have any medications for any illness, enough evidence to know what chemicals are there, and accordingly the medications have been designed. Then there is something called as psychotherapy. Simply it means talking therapy, or maybe what people say counseling, although counseling is a bit different from psychotherapy. But psychotherapy would mean that there is no medication given. Persons tend to talk with the persons and try to talk with the patients and try to give them some strategies on how to handle their emotions, how to engage in their work, how to engage with other people, improve their interactions. And depending on the source of the source of the depression, like let's say if the depression is because of somebody who has passed away in the family, it's a sort of a mourning is there. So that would be a different kind of a psychotherapy or counseling approach, as compared to if there is depression because of some other issue, issue which the person is facing in his work. So there would be a different approach. So that again depends on the picture, that particular person, what his circumstances are. So these are the main two things, medication and psychotherapy. Apart from that, of course, you have social workers and people like family therapists who sit together with the whole, because then if depression affects one person, it reflects on the entire family. Family therapists who sit together with families and try to help in this matter. So whatever is best for an individual is done, and it could also be a combination. Many individuals are worried about side effects, so it's not that. Most of the medications don't have dangerous side effects if they are used in the right proportion. Choose to have what kind of treatment you want, but you must always discuss with your doctor, because he'll be able to advise you on what are the different options. There will always be some different options for treatment, and it is of course, if the patient or the patient's family is free to choose an option which is most suitable for them.
Right. You read my mind, Dr. Sujoy, because it depends on the how much medication is given and the treatment options that are available. And definitely the list of the treatments options are there, so people can obviously take help and get themselves better in that sense. So thank you again, Dr. Sujoy, for sharing your expertise with us and helping all our audience to think more critically about their mental health state.
And that wraps up this week's episode. Thank you again to Dr. Sujoy for sharing your expertise with us and helping our viewers think more critically about their mental health state. Stay tuned, everyone, for next week's episode, The Connection Between Substance Abuse and Mental Illness. If you enjoyed our video and series, give us a thumbs up and comment below if you have any experiences dealing with mental health or have any advice for other people watching. Don't forget to subscribe to our channel and hit the notification bell button to be updated the moment our next episode is released. And be sure to follow our social media handles at VServeCanada to stay updated and in the loop. See you next week. Bye!